Do you experience knee pain while climbing stairs? Do you need support when standing up from a chair? Or perhaps you are frequently experiencing pain in your hands, fingers, back, or other joints, but dismiss it as a normal part of aging? But did you know that some common foods in your daily diet may be making your joint pain worse? These foods may not directly cause arthritis on their own, but they can contribute to weight gain, support inflammation in the body, cause rapid spikes in blood sugar, and in some people, increase uric acid and trigger gout attacks. In today's video, I will explain 7 categories of foods that people suffering from joint pain should carefully monitor. Make sure you watch until the end because foods number 5, 6, and 7 are not equally problematic for every person with arthritis. They are especially important for people who have high uric acid levels or experience repeated gout attacks. At the end of the video, I will also share a simple plate formula that can help you make your diet more joint-friendly without leaving you hungry. First, let us understand something very important. Arthritis is not the name of one single disease. In osteoarthritis, the cartilage between the joints can gradually become damaged and worn down over time. Rheumatoid arthritis is an autoimmune condition in which the immune system mistakenly begins attacking the joints. Gout develops when uric acid crystals collect inside a joint, causing sudden and severe pain, redness, warmth, and swelling. This is why some diet does not affect every person in exactly the same way. No single fruit, vegetable, supplement, or spice can rebuild damaged cartilage overnight. Similarly, avoiding one particular food will not cure every type of joint pain. However, a healthier diet can certainly support weight management, reduce inflammatory pressure on the body, and improve overall joint health. Let's begin. Sugary drinks. The first category that may worsen your joint pain is sugary drinks. This does not only include soft drinks, sweetened tea, energy drinks, packaged fruit juices, syrups, flavored milk, sweetened coffee, soda, and high-sugar milkshakes all belong to the same category. The biggest problem with these drinks is that you can consume a large amount of sugar and calories within a few minutes, but they do not make you feel full in the same way that solid food does. As a result, your total daily calorie intake may increase. Over time, this can contribute to weight gain and place additional pressure on your knees. Remember, your knees are weight-bearing joints. The more body weight you carry, the more pressure your knees must tolerate while walking, climbing stairs, or standing up from a chair. Sugary drinks can also be especially problematic for people with gout. The fructose found in many sweetened drinks may increase the production of uric acid in the body. Therefore, if you experience sudden and severe pain, redness, and swelling in your big toe, ankle, or knee, you should pay close attention to the drinks that you consume. What can you drink instead? Choose water, unsweetened tea, plain coffee, lemon water, or drinks with little or no added sugar. If you currently drink 3 cups of sweetened tea every day, you do not necessarily need to remove all the sugar on the very first day. Reduce it gradually each week so that your taste buds can slowly adjust. Number 2, white flour and sweet bakery products. The second category is refined carbohydrates. This includes white bread, biscuits, cakes, pastries, donuts, sweet rusks, cookies, and many bakery products made from refined white flour. An important point needs to be made here. Bread and carbohydrates are not automatically harmful. The problem begins when most of your diet is based on refined flour, added sugar, and low-fiber foods. Refined carbohydrates are digested quickly and can cause blood sugar to rise rapidly. This is followed by an increase in insulin. After some time, you may feel hungry again and start reaching for more snacks. When this pattern continues over a long period, it may contribute to weight gain, insulin resistance, and metabolic inflammation. For example, imagine that breakfast consists of sweetened tea, white bread, and biscuits. Then before lunch, you have another cup of tea with the rusks. The total number of calories can become quite high, while the amount of protein and fiber remains very low. A better approach is to reduce refined flour products and choose whole grain or higher fiber options whenever possible. Breakfast can also include eggs, plain yogurt, oats, or porridge. When eating roti or bread, combine it with a source of protein, vegetables, and salad. This can help blood sugar rise more slowly and keep you feeling full for longer. Number 3, deep fried fast foods. Third category includes food that most people already recognize as unhealthy, but often underestimate how frequently they consume them. This includes french fries, fried chicken, burger, pizza, and food prepared in oil that has been reheated multiple times. These foods often contain a combination of high calories, saturated fat, salt, and refined carbohydrates. The problem is not necessarily that you just ate one slice of pizza at a family gathering. The weird problem begins when fried foods become part of your routine several times a week or even every day. These foods are usually very calorie dense. This means that even though the portion may look small, it can contain a surprisingly large amount of calories. Frequently eating fried foods can lead to weight gain. As body weight increases, the mechanical pressure placed on the knees also increases. In addition, a diet dominated by fast food is usually low in fruits, vegetables, fiber, and healthy fats. If you enjoy pizzas and burgers or fried chicken, you do not necessarily have to remove them from your life completely. Instead, reduce how frequently you eat them. Consider using an air fryer, oven baking, grilling, or cooking with a smaller amount of oil. Instead of having a large sugary drink with your fries, choose water. Add salad or vegetables to your meal. Even a small change can make a significant difference to your overall calorie intake. Number 4, ultra processed and packaged snacks. The fourth category is ultra processed food. This includes crisps, salty snack mixes, instant noodles, sweetened breakfast cereals, packaged biscuits, frozen snacks, and many ready to eat foods. One way to recognize these foods is by looking at their ingredients list. It is often very long and may contain ingredients that are not normally used in a home kitchen. Many of these products are designed in a way that make portion control difficult. This contains combinations of salt, sugar, fat, and flavorings that encourage you to continue eating even when your body has had enough. As a result, you may consume more calories than you actually need. Research has associated high consumption of ultra-processed food with poor diet quality, weight gain, metabolic problems, and a greater risk of knee osteoarthritis. However, the word association is important. It does not mean that eating one packet of crisps will immediately cause arthritis. It means that when these foods become a large part of your overall diet, maintaining health can become more difficult. Better snacks options include a small handful of nuts, roasted chickpeas, fresh fruits, plain yogurt, chopped vegetables, or lower sugar snack prepared at home. Number 5, processed meat and excessive red meat. We are now moving towards the category that is particularly important to people with high uric acid or gout. Sausages, salami, hot dogs, processed burger patties, and other processed meat can contain amounts of salt, saturated fat, and added ingredients. Similarly, eating large portions of red meat very frequently may contribute to uric acid problems in some people. This does not mean that every person must completely stop eating meat. Meat can provide a protein, iron, and vitamin B12. The important factors are the portion size, frequency, cooking method, and your individual medical condition. If you have gout or your uric acid levels remain high, speak with your doctor or registered dietitian about adjusting the portion size and frequency of red meat. Other sources of protein can be included in rotation, such as lentils, chickpeas, beans, eggs, plain yogurt, and appropriate portions of chicken. Also remember that simply stopping meat may not solve the problem if you continue consuming sugary drinks, bakery products, and excess calories every day. Your complete dietary pattern must be considered. Number 6, liver, kidneys, and certain high-purine food. The sixth category is also particularly important for people with gout. Liver, kidneys, and other organ meats can contain high levels of purines. When the body breaks down purines, it produces uric acid. If the body is unable to remove uric acid efficiently, its level in the blood may increase. Uric acid crystals can then collect inside the joints and trigger painful gout attacks. Certain types of seafood may also cause problems for some people with gout, especially when eaten in large quantities or very frequently. However, there is an important difference that needs to be understood. Not all food containing purines affect the body in the same way. Some vegetables also contain purines, but research has not shown that purines-rich vegetables carry the same risk as organ meat and certain animal-based foods. Therefore, do not automatically stop eating all lentils, vegetables, and other nutrients foods simply because you have gout. Gout is not caused by food alone. Genetics, kidney function, certain medicines, dehydration, excess body weight, and other medical conditions can also affect uric acid levels. If you are experiencing repeated gout attacks, do not rely on diet alone. Speak with your doctor about checking your uric acid, kidney function, and whether medical treatment is needed. And number 7, alcohol, especially for people with gout. The 7th item is alcohol, particularly beer. Alcohol can affect both uric acid production and the body's ability to remove uric acid. In some people, it may trigger a gout attack. Beer can be particularly problematic because it contains alcohol as well as purines. If a person already has gout, high uric acid, or repeated episodes of sudden joint swelling, alcohol should not be treated as a minor issue. Another point is also important. If you do not currently drink alcohol, there is no reason to start drinking it for any supposed health benefit. If someone drinks alcohol every day or consumes large quantities, suddenly stopping can sometimes cause withdrawal symptoms. Such individuals should speak with a healthcare professional and make a safe plan. A common misunderstanding. Now let's address a very common question. Are tomatoes, potatoes, dairy products, or gluten harmful for every person with arthritis? The answer is no, not necessarily. On social media, one specific food is often blamed for all kinds of joint problems, but every person's body is different. If you have celiac disease, gluten sensitivity, lactose intolerance, or medically confirmed food allergies, you may require specific dietary guidance. However, removing an entire food group simply because of a YouTube video is not a good idea. Doing so may lead to deficiencies in protein, calcium, fiber, or other essential nutrients. If you believe that a particular food makes your pain worse, start keeping a food diary. Write down what you ate, how much you ate, and what symptoms you experienced during the first 24 to 48 hours. Then discuss this information with your doctor or dietitian. Now, a joint-friendly plate formula. Now the question is, what should you eat? Fill half of your plate with vegetables and salad. Use 1/4 of the plate for proteins such as lentils, chickpeas, beans, eggs, fish, chicken, or an appropriate portion of meat. Use the remaining quarter for whole grains or a controlled portion of carbohydrates. Drink water with your meals and do not make sugary drinks part of your daily routine. Eat whole fruit instead of drinking fruit juices because whole fruit contains fiber. Healthy fats can come from appropriate portions of nuts, seeds, and olive oil. Most importantly, do not ignore the portion size. Even healthy foods can contribute to weight gain when eaten in excessive quantities. Research suggests that in people with arthritis who are overweight, even moderate weight loss may improve pain and daily physical function. Physical activity is also essential. Joint pain does not mean that you should completely stop moving. Walking, swimming, cycling, water-based exercises, and strength exercises recommended by a doctor or physical therapist can help strengthen the muscles surrounding the joint. When should you contact a doctor? Well, if a joint suddenly becomes extremely swollen, red, hot, or unbearably painful, or if you develop a fever or cannot place weight on the affected leg, do not assume that it's only related to food. In addition to gout, these symptoms may also indicate an infection, injury, or another serious condition. Similarly, if your joint remains stiff for a long time in the morning, if the joints in both hands or both feet become swollen, or if your symptoms are continuously getting worse, you may need to be evaluated for rheumatoid arthritis or another inflammatory condition. To summarize today's video, people with joint pain should pay to sugar drinks, refined bakery products, deep fried foods, ultra processed snacks, and excessive processed meat. People with gout or high uric acid may need to pay additional attention to red meat portions, organ meats, certain types of seafood, and alcohol. But remember that the goal is not to become afraid of every food. The goal is to improve your overall dietary pattern. Eat more whole and minimally processed foods, maintain a healthy body weight, remain physically active, and seek medical treatment when necessary. Changing your diet alone may not completely treat every person's joint condition, but a healthy diet can certainly become an important part of your overall health plan. Which of the 7 categories do you consume more frequently? Let me know in the comment section. If you found this video helpful, please share it with your friends and family, especially with someone who is suffering from knee or joint pain. Like this video, subscribe to the channel, and press the bell icon so you do not miss our upcoming health videos. Take care of yourself. Stay healthy. I'm Dr. Raza. Your better health is my mission. See you in the next video. My name is Dr. Raza. I am a practicing family physician in USA for the past 18 years. I am an American board-certified physician and diplomate of American Board of Family Medicine.